The official start of hurricane season was June 1st, and this year they're calling for an above average storm count. Of course, we're going to keep you updated on that, but are you prepared? Are you ready for what it could bring? We're here now with Dr. Carrie Bakunas, emergency medicine physician with UTHealth Houston, to go over all the things. Just a reminder, because we want you guys to be prepared. Thank you so much for being here with us.
Thank you for having me.
Okay, so let's start. Let's remind folks about the preparedness kit. There are lots of things that you should pack now, right? Or just go to the store and pick up and have ready to go, because we're in it now.
Yeah, so ideally you've got 1 to 2 weeks worth of supplies. This would include, of course, water for your family, non-perishable food goods, batteries, flashlights, chargers for phones and other devices, and then, of course, medications.
Okay, all right, keep that all together. What about injuries? Because, you know, that's another big thing. If you're out in water, high water, if you get cut, kind of remind people, because we've seen it during Hurricane Harvey. People had to go through high water to get out of where, you know, they had to leave, they had to evacuate. So talk about some injuries that people should just kind of be reminded about.
Yeah, so in general, the recommendation would be to not go out in flood water. It can be pretty disgusting, lots of bacteria. So if you do sustain injuries, you can get some serious infections. And so we would recommend that you don't go out in flood water. Obviously, don't drive, and if you're flooded, you want to stay sheltered in a safe place if you've not evacuated.
Yeah, and we can talk about the shelter, because if you're, you know, what is the best thing is to stay put, right? To stay at home, stay, you know, in a shelter where you're not out in the elements, unless you have to leave.
Right, so unless you've been advised to evacuate, and if you are sheltering in place, it's important to stay on a bottom floor in a room without a bunch of windows or skylights or glass doors, because those can get damaged and cause injuries.
Yeah, and I think the saying is, you don't really get hurt from the actual storm itself. You get hurt from flying objects, right? Like debris or maybe like a window breaking.
Exactly.
And you're near it. All right. What about when you have to evacuate? If you are, you know, unfortunately going through flooding and they're telling you got to go, you got to leave now, what do families need to keep in mind?
So the important thing for evacuation is to make sure that you've got a plan. So you want to have a plan with your family and your loved ones. And then, of course, you need supplies. So you've got to have those medications on hand and available, flashlights, phones, chargers, all the same stuff that you would have at home. Just you've got to have it in a bag ready to go, and then a plan in case you don't have a way to communicate with your family or your loved ones.
Okay. Probably like maybe like a radio, an old time.
Or just
stay informed.
Yeah, just knowing, like, here's my plan. I'm going to go to this location, or I'm going to shelter in place.
Yeah. All right, let's talk about staying informed, because that's true. During Hurricane Harvey, man, a lot of cell phones didn't work, right?
Yeah.
A lot of communications devices did not work. So you got the plan. Now what?
So I think keeping up with local weather and national weather advisories is really important, so you know if something is coming. Sometimes we don't get a ton of heads up, but if you do get that heads up, knowing and getting your plan ready is what you need to do.
And what about for families who maybe, you know, have been through hurricanes before, and they're just kind of worked up now, seeing the storms that have come through, and they're feeling anxiety? What's the best way to kind of deal with that as we go into this busy season?
Yeah, that's a good question. It's definitely anxiety provoking, and I think the best thing is to face it head on, get prepared for the storm, have a plan, and that way if something happens, you're ready and you can handle it accordingly.
Yeah. Okay. All right. Anything else that folks need to know? Is it too much? Should you be prepared? You know, more things, it's fine.
I feel like you're better to always be over prepared, right? So some people will say 3 days, some people will say a week. I say if you have the ability to, plan for 2 weeks of supplies just in case you need it, especially when it comes to medications, and then of course keeping your gas tank full.
Yeah, and you had mentioned another thing before is, during a lot of these emergencies, a lot of the doctor's offices, places to get medicine, they may not be open.
Right, so emergency departments really tend to get kind of overwhelmed during times of a storm. So patients who would normally get dialysis are missing their dialysis sessions, and they come to emergency departments, or patients who can't get routine care through their primary care come to use the emergency departments.
Yeah, so all right, keep all of this in mind.
Yeah.
This is all really great information and advice. If folks want to reach out to you, where can they find you?
So I work at Memorial Hermann in the Texas Medical Center, and you can find us there. Hopefully we don't see you as a patient.
Yes.
But
all right. Thank you so much for all of this great advice, Doctor.